I think it also could be fun to know if it's your first pregnancy or second pregnancy if you're expecting. Um, I mean, we're assuming that you're pregnant or expecting a baby in some capacity, but maybe you're here for another reason. So tell us all the fun things.
I love it. And I apologize. I now just toggled on the chat. So it should be working. If you
All
toggle on
right.
everyone, you should be able to chat with everybody. Here we go. The chat is officially open.
All right.
We got a Houston, first pregnancy here, first time pregnant mama.
And welcome. I have a NAPS pregnant support group, and all of the moms who I usually meet with on Fridays are here today instead of our usual meetup. So hi to all my NAPS pregnant moms who are here.
What's up,
Welcome. I know. So
Emily?
excited.
How many moms are a part of your group?
We do 10 moms per group just so it doesn't, get
Yeah,
too overfull. Up to 10. Yeah.
love it. I love it. Oh my gosh, we have people literally from everywhere. A lot of first time pregnancies. And everybody make sure to toggle on when you type in the message above it, toggle on everybody because while we just love it says hosts and panelists, we love to see it, but we want the energy to radiate. So with that, we're gonna go ahead and get started. Feel free to continue to introduce yourselves. Today you are here for finding comfort during pregnancy, which can honestly feel a little bit like maybe it's an oxymoron. I'm 33 pregnant now, and Emily and I have had this conversation. I'm not feeling too comfortable, but rest assured, we have some wonderful experts here today that are going to talk about how we can mitigate pain and the discomforts that come through pregnancy. So, next slide, please. So I'm with Mom Cozy, and Mom Cozy is a global brand. We've been around since 2018. Our staple, you know, is probably the wearable breast pump, but we sell a range of products. We now have 3.6 million moms around the world that use Mom Cozy products, and our commitment is making sure we innovate and create cozy designs born from love so we can make your life easier wherever you're at. Please join our community. This is our QR code. We have a wonderful, rich Facebook community of 22,000 moms that help each other, like at all hours of the night, from Japan to teeny tiny Des Moines, Iowa. Join us there because we have a lot of encouragement and we have great event updates as well. Welcome, Vanessa. Vanessa's from Chicago. And today we have a very special giveaway. You have to stay till the end. We're going to give away 5 of Mom Cozy's Maternova belly bands. This is the new upgraded belly band. I'm telling you, my belly band is saving me. And Dr. Alex is going to walk us through how these bands help us. But just because you're part of our webinar series, you can get 15% off this band with the webinar, the code webinar HQ1, and you'll get an email at the end of this as well.
All right.
And one quick housekeeping item, everybody. You're going to have questions throughout this entire presentation. Please do not put your questions in the chat because it is really hard to get to. Instead, put your questions in the Q&A function at the bottom of your screen. And when our team is able to get to them, they're going to get to them in between presenting. So have patience with us. And throughout the series, we will have moderators later on to make sure your questions can get answered. With that, I'm going to turn it over to the amazing Emily Silver.
Right. Thanks everyone for being here. I may have crossed paths with you already. As coming on and teaching for Mom Cozy is something that we've been now doing for a year, which is really exciting. So maybe you've been with us at previous webinars or classes, whatever you want to call it. But my name is Emily Silver. I am a former labor and delivery nurse, currently a family nurse practitioner, also an IBCLC. I'm a mom to 3 girls, and I'm one of the founders of NAPS. I'll tell you more about NAPS towards the end, and we're going to give you some ways to access us after this, both free and some discounts. But what you need to know is that NAPS is a company of all experts, registered nurses, nurse practitioners. We also have experts like Dr. Alex DeGrado inside of our platform, where we offer support and education to parents when they are expecting a baby, through the newborn and then the baby years into the toddler preschool years. And this is all done through our online membership, Nurture by NAPS, from prenatal classes to webinars like this, peer support groups. I know I mentioned my pregnant group that meets. There's a lot of different ways that you can work with us. And what I just would like you to know at this moment before we dive in is that our whole thing is that we're all medical professionals. We're real nurses. We have these great backgrounds in maternal child health care, but a lot of us are parents just like you. And so that's where we slide in the real life parenting advice. We will never judge you. It is a safe space to help you navigate options so that you can make decisions that are best for your family. And with that, I'd like Dr. Alex to introduce herself as well.
Hi, everyone. Welcome. I'm so grateful to you all for being here. I am a mom of two myself, and I had a C-section with my first and a VBAC for my second, which is a vaginal birth after C-section. So, personal experience, I've also been a pelvic health specialist for 15 years. So, I am a doctor of physical therapy and a pelvic floor physical therapist. So, I love to talk all things pelvic health. There's no such thing as TMI when you're talking to a pelvic floor physical therapist. So if it's pain with sex, hemorrhoids,
Mm.
all the surprising aches and pains that come up during pregnancy and postpartum, I'm here for it all. And as Emily knows, we are open books about our own experiences as well. And I am the founder of Boston Pelvic Physical Therapy. We have a clinic in Melrose, Massachusetts. I also have a postpartum recovery course, the Healthy Pelvis Project. I'll be happy to link those in the chat.
Yeah. And Alex and I are going to be calling out many of those symptoms that we know many of you are going through today, too. I will also just say, now that I've said I'm a mom of three, for my three pregnancies and my three postpartum experiences, Dr. Alex helped me tremendously. And so I always feel very excited on a personal note to spread the knowledge in the pelvic floor space. I'm just going to kick us off and come at you as a provider who spent a lot of times, especially in the hospital and in the office with pregnant patients and now working I do a lot of telehealth with women who are expecting, and I just want to set the stage and call out common things that I know you experience, and I'm sure many of you are experiencing. In fact, this isn't even all of them. There's quite a list of aches and pains and discomforts that we experience. When it comes to postpartum, there's actually 28 physical symptoms that women experience postpartum. And through research, we know that in the first 6 months of postpartum, women experience 5 to 6 of those symptoms, ranging from back pain to breast pain to pelvic pain to your C section on this big list. When we work with women who are expecting, when it comes to physical changes, we're hearing a lot of discomfort around round ligament pain, obviously lower back pain, and as you can experience and imagine, I'm sure, this pelvic pain and pressure, everything's growing, your body's expanding, there's so much weight, which can lead to sleep struggles, waking up in the middle of the night with a charley horse or a leg cramp. Other things I always call out in our prenatal classes, the hormonal changes that we're going through. We can experience changes in our mood and perinatal mood disorders in pregnancy. GI issues. We already said the word hemorrhoids. We're here for a good hemorrhoid talk at NAPS, but from all the pressure for the gut is slowing down in pregnancy. We talk about Braxton Hicks contractions in those final weeks of pregnancy, that those can be uncomfortable. And really randomly, carpal tunnel syndrome. I always throw that out there because people don't think their hands are related to their belly. We're going to go through some of these symptoms, and Alex is going to give you amazing tools to help you. What I want to say about this as a provider is, in the maternal space, like when we're working with pregnant and postpartum women, it's very common for providers or just people in your world to tell you that these things are normal. We label a lot of things as normal that really aren't. And so I'm here to tell you that these things are common, right? I'm not saying it's abnormal or something scary and bad is wrong, but I'm going to let you know that they're common. And even though they're common, there are ways that we can make them better. And so we want you to know how to talk to your providers and who you're going to for help. So when it comes to navigating prenatal visits with any provider, and you're uncomfortable and you feel like you're not being heard, or maybe you're just not sure how to bring it up. A lot of women tell me, like, I didn't want to complain, I want to bring it up, like I should be able to do this, I should deal with this. I can do it, right? It's sort of like, sure, or let's make you comfortable. So I'll usually teach the patients that I work with to show up at appointments with some notes and with some thoughts. I'm experiencing back pain and it's really impacting my daily life, or it's really impacting my sleep. What are the options for me? What are my options? Write it down now. Like, that is your big question to always be asking your providers. Because if I said to you, I have back pain, and it was then the reply was, I know that's so hard, that's so normal. The conversation could then be over. So it's, I have back pain. Oh, I'm sorry, that's so common. Then you get to say, what are my options for back pain? Because I'm really struggling. And that just is going to open up the door for them to say, okay, maybe we're going to refer you to pelvic floor PT. Have you tried Tylenol and heat? Whatever it may be. If you're having trouble knowing who can help you, it's also okay to ask your provider, can I get a referral to a specialist? Do you have a list of these specialists? Can you make a recommendation of who I could find on my own to be seen for this? And if you're right away offered medication, there are medications that we can take in pregnancy. There are medications that we use postpartum. But if that's the first line that's offered to you and you're feeling like you'd rather explore other avenues first, that's also very reasonable. And so another line that you may throw out there is, before we talk about medications that could help, can we discuss what are the other options? So I think I've said it a few times now, but what are my options is my favorite line. All right. And before Dr. Alex kicks it off, when we think about options, a lot of time the pregnant patients that we work with through NAPS just truly don't know what those options are. And so when I think about looking into spaces outside of medication, and I am not saying to not take medication, I needed medication for various reasons in my pregnancy. I just want to open up the door to other avenues for you, which is going to be your pelvic floor physical therapist that can really help strengthen your muscles now in pregnancy, help you with, I saw a mom before this and she said, can I see them now for back pain? I said, absolutely now for back pain. Don't wait for the baby to be here. There are things that they can address now in pregnancy and then when you're postpartum. We lean a lot into massage, acupuncture. There's probably great chiropractic care places in your towns, and they can help with postpartum discomfort, pregnancy discomfort, postpartum healing. Physical therapists out there in your network. It's great if you can find one that specializes in women's health and mental health support. Because even though some of these are physical symptoms, they take a toll on your mental health. They really, another mom I talked to this morning who's pregnant has just been so sick, and it's like, oh, just really dark days. I don't know if anyone else out there has had throwing up and hyperemesis, but it gets dark and lonely. And so having someone to just talk to can also help for your mood and to talk about the physical symptoms you're going through. But let's dive in and let's actually talk about your pelvic floor, and we want you to have actionable tools, and that's where Dr. Alex comes in. We want you to walk away having a few things you can actually do today that are going to help you.
Thank you so much, Emily. Okay, so I have my nerdy pelvic model because
Love it.
I remember 15 years ago, the first time I saw this, and I was just shocked to find out that these muscles existed. And so these muscles are your pelvic floor muscles. And I'm going to orient you to what we're looking at and talk about how we can help these muscles thrive during this season of life. This is the front where your pubic bone is. Sometimes people will get sharp pubic symphysis pain right here where this cartilage is in the front. This is your clitoris. We should put a big gold star for our partners right there. This is the urethra, the vaginal opening, the perineum, and the anus where you have a bowel movement. These muscles are under our conscious control, which means that we can exercise these muscles and help them be strong and help them have good range of motion during pregnancy. And so if you look at it from the inside, you can see that the muscles look like a trampoline or a hammock. And if you think about a trampoline, there's supportive structures all around it that help hold it in place. And for us, that's our pelvis and our hip bones and our low back. So much of low back pain can be, and tailbone pain right here, your coccyx, can be related to your pelvic floor muscles, which attach right to those structures. And so we talked about low back pain briefly earlier, and so much of that can be coming from pelvic floor issues. And these muscles have to contract to stop us from peeing on ourselves. So if you cough or laugh or sneeze, these muscles are supposed to close the urethra, which is the tube that you pee through, and stop the pee from being able to come out. If the pee is coming out in your underwear, that's called incontinence. And we want these muscles to be able to stop that from happening. We also need these muscles to be able to effectively pass a bowel movement and to be able to effectively stop gas and bowel movement as well. They also play a role in holding our organs in our body. So if anyone's ever had that sensation like something's falling out, like a tampon sticking out, or like there's a lot of pressure, heaviness, like something is too low, that is part of the pelvic floor's job, is to prevent what's called pelvic organ prolapse, which is when those organs kind of dip a little bit too low into your vagina. And so these muscles have to be able to close and lift and also lengthen, relax, and open. And a lot of you might be able to imagine a time in the very near future where these muscles especially need to be able to lengthen, relax, and open. And that is when your baby is coming through here. And so there's a lot of emphasis on social media on Kegel exercise and tightening and squeezing these muscles. But for labor and delivery specifically, we need to be able to lengthen, relax, expand, and make space for our baby to come through the pelvis and out of our vagina. And so these muscles have to be able to close and lift and release, relax, expand, and open. And so I'd love to run everyone through an exercise now as we're watching to figure out where are you at in that spectrum. Many of us hold too much tension in the pelvic floor. And what that means is if you, for example, experience pain with penetrative intercourse or with a speculum exam, if you're a power peer, so if you push to pee and you feel like you can't get all the pee out, that could be a sign that you're holding too much tension in your pelvic floor. If you strain for a bowel movement, if you feel like when you push, you can't open the muscles or the stools come out pencil thin or you're getting hemorrhoids, that can be a sign of too much tension in the pelvic floor. Or if you run to the bathroom too frequently and you feel a lot of urgency, that can be the pelvic floor muscles pressing on your bladder and making you feel like you have to pee. So that is another kind of series of reasons why the length is just as important as the strength. So let's do an exercise together to kind of get our brain to connect with these muscles, because I always say it's not as easy as doing a bicep curl where you can just look at it and say, yep, I'm doing it, because it's inside our bodies. So it's more of an intellectual exercise than anything else. And so I want you to kind of shift in your seat from side to side and forward and back, and notice your sit bones, the bones that you're sitting on. And then notice that pubic bone in the front and then your tailbone in the back. And find a way to get your brain to bring your attention to that part of your body. And so now that you can feel where you're sitting, these muscles run right between those sits bones. And so we want to be able to feel like these muscles can lift away from the seat that we're sitting on and then lengthen, expand, and open back into the seat. And that is so essential for what we're working on today, because we want these muscles to lengthen, expand, and open for labor and delivery. Also, if you're already experiencing some low back pain or some tailbone pain, being able to relax and expand your pelvic floor can help with some of that pain. I also notice with pubic symphysis pain that sometimes it's because one side or the other of the pelvic floor is so grippy and tight that it can't let go, and we get pain there as well. So now that you're aware of your pelvic floor, I want you to take a big deep breath in. And the visual that I like to do is I think about the canister inside my belly. So you have your diaphragm at the top, your pelvic floor at the bottom, and your baby in the middle, and your belly muscles. And we want to think about filling that canister like imagine like a water balloon. As the air is coming in, that's the water, it's expanding those muscles. So you're taking a big deep breath in, and the whole area where your sits bones are lengthening, expanding, and opening. And then on the exhale, you're closing and lifting and drawing it up and in. Sometimes I say it's like you're sucking a milkshake through a straw in your vagina, or like picking up a blueberry with your vagina. Or you can think about holding back gas or stopping the flow of pee midstream. And then you want to really lengthen, release, and relax and let go. Sometimes people will notice that once they get into the squeeze, they're kind of stuck in the squeeze. And that is another way that you can self-identify if you are holding too much tension in those muscles. We want to feel the muscles relax and lengthen back into the seat. And right now, as I'm doing it, I'm exaggerating, but in reality, it's not the glutes, it's not your buttocks muscles, it's not those bigger hip muscles. It's really that trampoline, that hammock of muscles inside. And so kind of through this talk, feel free to just experiment with feeling that way as you kind of notice those muscles, notice the sits bones, and experiment if you can feel that length, if you can feel the relaxation as you're breathing. So that's pelvic floor 101. These are pretty important muscles. And now we're going to talk about some other related aches and pains. Round ligament pain is the sharp pain that you experience right in the front on the sides of your belly. And when I had round ligament pain, it was primarily when I was running late to pick up my older child from daycare, and I would be trying to get out of the car too fast. So a lot of times quick movements trigger it. And so it's that sharp stabbing pain that you feel right along those front ligaments. And it is amazing when you see how much these ligaments lengthen and stretch and expand in order for our belly to grow. And so naturally, there's some growing pains here. Just like when we were kids and we would feel growing pains in our knees and elsewhere, these pains are because everything is stretching and it's not always a smooth process. And so it can be getting out of bed, it can be trying to get up from a chair too quickly. And I absolutely love the picture that I have in this image, and I did it my whole pregnancy. And what you want to do is, as long as you don't have any pubic symphysis pain, which is the pain right in the front, you want to get in a kneeling position, and then you're going to come reaching up and over. And I'm going to demonstrate it for the group so everybody knows how to get into this position and how to get that stretch. But first, I want to say, what if you're in the car, or what if you're just getting out of bed? You have to be able to have a move that isn't getting on the floor with your ball to stretch. You need to be able to do something in the moment. And what I will tell you is prepping for the movement is so helpful for a myriad of reasons. And what I mean by that is, if you're sitting in your car, doing some seated cat-cow tilts, doing some circles as you're sitting there. If you're getting ready to get out of bed, you can do the same thing, rocking your pelvis back and forth, getting those ligaments ready to stretch. So you're almost getting some blood flow, you're getting some oxygen to that area, so it's not as shocking when you go to move. So if you're in the moment and you don't have a chance to be doing this beautiful stretch, those are some strategies that you can use to get yourself ready. And if you have enough space, you could even do the reach part of it just before you get up. Big deep breath in, rock back and forth on your sits bones to your tailbone, and then go for the move. And the other great thing that we say is blow as you go. And what I mean by that is you want to exhale as you move. So when you go to get up out of the chair, you want to blow the air out, which takes a lot of the pressure off of your pelvic floor and your ligaments as well. So I'm going to get into this stretch. Those of you who are in a position where you can do it as well, please feel free to join me. I'm just going to tilt down a little bit so you can see my yoga mat, and then you can see in real time what it's supposed to look like.
Perfect. You look good. Alex, do you find that you use the ball the further along you go in your pregnancy to like help
Absolutely.
balance, basically? Okay.
And if you don't have a ball, you can use a chair, and you could use your couch, you could use your coffee table, anything that you have around you just to stabilize, because your balance centers shift so much as your belly's growing. And when I did that stretch, you may have noticed that I shifted my body up a little bit, and don't hesitate to kind of move in the position and take big, deep breaths and breathe into the side that you're stretching so that you can have that sensation of getting into that round ligament. And so it's stretching the hip flexors, it's stretching the whole round ligament, and it just feels incredible. And I feel like so many of us need that when we're going through this pain, which can start on the early side. I remember my round ligament was kind of in the beginning when things were really starting to stretch.
Yeah, 100%.
Mm-hmm.
I feel like a lot of people complain of it just as early as really surprisingly, the first trimester.
Yeah, exactly. Yeah. And I think
Bloated, pants don't fit anymore, and all of a sudden there's that pain.
yes. And it can be so surprising, but it makes a lot of sense with the hormonal changes that are happening. These ligaments are prepping, and it's uncomfortable.
Right.
Back pain. I don't know that I've ever met a pregnant person who doesn't experience back pain.
I have not yet met one either, just gonna say
Yes.
as well.
And it's so much. And so I would say, for me, the Mom Cozy belly band is a lifesaver. It just supports your hips, it supports your belly, it takes some of the weight off, and it almost gives you a hug. So as everything is spreading apart, this is the one time in life that I feel like you really do need that external support, because you know, you're growing so quickly. And even if you're strengthening, you need some extra support, you know? And so that's the supportive shoes, not wearing flip-flops in the middle of the summer. We're not there yet, but I can't say like your feet are growing, your feet are swollen, and you just want to wear flip-flops, but then you don't have the support. So I think getting as much external support as possible. In the PT clinic, I'll be taping my patients' bellies. We use the Mom Cozy band. We get supportive footwear. We're thinking about getting some external support to hold everything up. And then obviously stretches, because the stretching in those tight low back muscles, if you think about how much your posture changes throughout the course of pregnancy, it's incredible. And so all of those lower back muscles get short and tight and start to really cramp up. And we get into almost what we call an anterior pelvic tilt, where we're sort of hanging out in that space. And so we want to make sure that we are stretching those back muscles, which on the next slide, I'm going to demonstrate to everybody.
Hey,
And
Dr. Alex,
yes,
so
please.
sorry to interrupt real quick. When you did your previous stretch, Emily said something. So the screen switched to her, so no one was able to see your stretch.
Oh,
When you do your next stretch, could you, yeah, it's okay, Emily. It's fine. When you do your
I'll
next
show
stretch,
it again.
yes, please. Thank you so much.
I
would be
will
happy to.
talk when you show it again.
Yeah, don't talk when she shows it again.
That's okay. Well, I love that stretch so much. I'd be more than happy to repeat it. It's one of my faves, and you don't have to only do it during pregnancy. You can do it postpartum, which I am. So I'd be happy to show you again. Okay. Another huge thing during pregnancy for back pain is getting manual therapy. And when I say manual therapy, that could be a prenatal massage, that could be seeing a pelvic floor PT to release some of the tension in those low back muscles. But as your body is trying to accommodate the growing weight and the changes that are happening so rapidly in your body, a lot of trigger points and knots and tension build up, and that restricted tight tissue causes some of that pain. And so anytime that I could get in and see one of my other providers when I was pregnant, I would come and do that, because it feels so good. It gets the blood flowing. And I think it helps you to be able to engage those muscles better. So a lot of times when the muscle is already so short and tight and angry, if we just try and strengthen it, or if we just try and stretch it, it's too upset to let that happen. And then certainly you can all see on the slide that if it's severe, if you are noticing, changes in your discharge, certainly call your OB. And numbness and tingling in both your legs. Sciatica is a very common pregnancy related issue, but it's worth talking about so that you can get the help that you need. So now we're going to go into exercises for low back pain. And I will also show you my favorite stretch for the round ligament pain, which we did on the previous slide. But what I will sort of preface it by saying is, if you're having pubic symphysis pain, which is that pain right in the pubic bone in the front here, that deep hip flexor stretch might be too intense for you. This stretch is more for round ligament pain, which is up in your belly. So not like the lightning bolt pain in your pubic bone. Okay, so I am going to demonstrate some of these for all of you. And what I will say is this is a combination of strengthening and stretching. A lot of us are afraid to exercise during pregnancy for various reasons. And the truth of the matter is there are safe exercises you can do during pregnancy, and we want to support our body, and we want to give our body the strength and flexibility that it needs to feel our best. And so I think small kind of consistent movements that feel right for your body, or having a pelvic floor physical therapist who's guiding you throughout pregnancy, can make you feel so much better. And it doesn't have to be 12 or 13 exercises. And I joke with my patients, but it's not really a joke. We do 4 exercises, because especially if you already have another child at home, or if you're working, we all have busy lives. It needs to be manageable and actually able to complete. So if you're trying to do it at home, just choose a few, don't overwhelm yourself with too much. And so we're going to go through the cat-cow, the thread the needle, the bird dog, and squats to the wall, 2 stretches, 2 strengthening exercises, and I'll do the hip flexor stretch too. Emily, I see you muted yourself. That's perfect. Okay. I am just going to run you through them, and I will try and talk loudly so that you can hear me. But for the most part, I'm just going to be breathing and demonstrating so you can see what they should look like. Okay, so this first one is to release that excess tension in your low back. So this is an amazing stretch for low back pain, but I also want you to think when you're in the arch, lengthening and expanding your pelvic floor by spreading your sits bones apart when you're stretching. So in your stretch, we're rounding and then we're arching. And when you're arching, you want to think about spreading these muscles apart, which is prepping them for labor and delivery. Put you down a little bit. For this one, you can modify by just doing the legs or just doing the arms. And the last one is a squat to the wall. And for that one, you don't want to go too low or too deep. We're really just trying to get the glutes to turn on and then stand back up. And so for any of these, you want to think about your pelvic floor and your breathing while you're doing them. And that just felt so good. I feel really invigorated by that. And each one of those kind of helps you to get in touch with your pelvic floor, but also release some of the tight muscles that are in there. And so I love these stretches. These are some of my faves that I do during my own pregnancies, but also they kind of cover the bases for a lot of what people experience. And the bird dog is especially good for anyone who has noticed that you kind of lose your glutes, you lose your buttocks a little bit because we're just shifting for our belly and our glutes just go away. So sometimes people call it mom butt, which I don't love that term, but the bird dog and the squats to the wall are both great exercises for that. Okay, so those are my fave exercises. Emily, you want to talk about some of these ones?
Yes, before I jump in, do you want to show the one that I interrupted you again just one
Thank you.
time, just to
Yep.
make sure everybody's clear?
Yep,
And then
thank
I'll
you.
come into our other stuff here.
So the hip flexor stretch, you're going to come forward on one leg and you're going to reach up and over. And then you can switch sides. Reach up and over. And then you can use a prop like a ball or a chair. To help you with your balance. Thank you, Em.
No problem. All right, we're going to come back to Alex again for more tips and tools, but we wanted to also highlight some of the other things that come up in pregnancy that I know are quite common and ailing some of you. You can tell me in the chat if I'm hitting the nose on, if I'm hitting it on the head here, but a lot of times outside of these like physical pains, the other big things that we see are issues around like GI issues. We'll talk about, you know, how it slows down in constipation, trouble sleeping, and just managing changes in your hormones and how your mood is changing. So I just want to break them each down and give you some thoughts so that you can talk to your providers. When it comes to your GI system, pregnancy and the hormones of pregnancy, and as you grow your baby, especially the further along you get, it really starts to slow down your digestion. And in labor, your body really starts to send all of the energy to the labor process. So the gut also slows down as well, which is why when you're postpartum, we are encouraging fluids and collace and like trying to get your bowels going again. Um, Throughout pregnancy, we often hear women reporting constipation, which can lead to hemorrhoids. There are many women out there who experience hemorrhoids and they maybe weren't constipated at all. It truly could just be from all of the pressure. And now that Alex has shown you that trampoline, and it really is a trampoline, right? Like I feel like I've been jumped on 3 times. That weight, that pressure is pushing on your bladder and your bowels. And so sometimes just the pure weight of the pregnancy can cause hemorrhoids to happen. Um, so, when we're thinking about these things, I would like you to bring them up to your providers. Obviously, we can encourage hydration and fiber and stool softeners if needed. If you are experiencing hemorrhoids, there are over the counter and prescription suppositories and creams and wipes that you can get from your provider. We use sitz baths often, especially in the postpartum space if hemorrhoids are still there, which is a basin that you fill with warm water and stick in your toilet so you can sit into it. A lot of women are running baths to try to get relief in pregnancy, and that can be hard. So, sitting in a sitz bath can be a little bit more convenient. And then, in addition to having patients go to their provider for potential prescriptions or advice on what to use to treat these things, I'm also referring again to pelvic floor to get those exercises going to help relieve pressure. When it comes to sleep, we're going to show you the Mom Cozy pillow. And I have it here. It's so soft. I did sleep with a pillow for all 3 of my pregnancies. I don't know if anyone else out there is using one as well. But as you get further along, it does just feel like it's harder and harder to get comfortable when you're going to sleep, especially if you're having any of the other pain or discomfort that we already mentioned leading up to this. As your uterus is growing and your belly's getting bigger, it's not only pushing down on your bowel and your bladder, causing you need to get up frequently to pee at night. Anybody else out there, right? But also it's pushing up on your diaphragm, which is making it harder to take a deep breath, and it's contributing to reflux. I don't know if anyone gets some like heartburn or a little bit of reflux at the end of the day when you finally lay down. So, we're just trying to do our best to get you comfortable. And so that's where using pillows or pregnancy pillows can really help, because you can get yourself into a position that slightly elevates you to help with reflux and heartburn. And the way that you can manipulate the pillows can help alleviate back pain. You can get it between your legs, and it really can create this nice shape, which we're going to show you and talk about more on the next slide so you can see it here. But we're trying to get you comfortable. I do want to call out now is that it is actually more so a myth, and it's not based on research, that you can't sleep on your back in pregnancy. I know that you will Google and hear and read that you have to sleep on your left side. And it is great if you can sleep on either side, left or right, because usually that's how you can get yourself most comfortable. But if you wake up on your back, or in the end, if you choose to sleep on your back and you're very well supported by pillows, that actually is okay. The thought about sleeping on your left side, again, isn't based on evidence-based research. It's based on a thought that if you lay flat on your back, it can compress blood flow to mom through a vein that runs in your back that could potentially decrease blood flow or oxygen to your baby, which sounds really scary when I say the thought out loud of what, people are worried about. But that's actually not supported in the research. And there are many women who wake up on their back in pregnancy and panic and then turn to their side, or they're really afraid. And so I just want to put it out there that laying on your back in your 3rd trimester just isn't going to be comfortable, right? It's harder. You wouldn't want to be flat anyway. It's harder to breathe and be comfortable. But if you want to support yourself like a throne with pillows and get comfy, that's okay. If you enjoy sleeping on your right side instead of your left side, that's okay. If you wake up on your back in the middle of the night, please do not panic. Just roll over, get comfortable again, and go back to sleep. Hormones and mood shifts, I'm not going to give this the time and justice that it deserves, and we have way more content at NAPS on this, but I will just call out while we're here in the interest of informing everyone is just that it is very possible to experience not just the hormonal, you're obviously experiencing hormonal changes in your pregnancy, but mood shifts. And in fact, perinatal mood disorders like anxiety, depression, intrusive thoughts, obsessive compulsive disorder. These things can seep in pregnancy or postpartum. And so we talk about them a lot at NAPS. That way you're informed, your partner's informed, and your people around you are informed so that if you are struggling, you can seek that support, which is why on the provider slide, I did list a therapist. I feel like the best things that you can have in your corner when you're postpartum are a lactation consultant. So let me know if you need help, a pelvic floor physical therapist, so let Dr. Alex know if you need help, and a mental health counselor, someone to support your mental health. So a little bit on that just to get your brains kind of thinking. We want you to be taking care of yourselves. All right. So I know we can't talk at the same time. I'm gonna turn it back to Alex because we really, Mom Cozy has these great tools and Alex and I use them all the time. So we just want you to understand why we like them and how to use them because they really can provide tremendous support for you in your pregnancy.
The first tool that I kind of mentioned already because I love it so much is the belly band. And the belly band is something that I used during my pregnancies. And as you can see in the picture here, it really gives a little bit of upward support to the abdomen, but it also wraps around the low back. And what I would suggest is use it as low as you can. So when you put it on, you want to put it on as low around your hips, kind of all the way down towards your sacrum. And you can imagine as these are spreading apart and separating, you want to feel that compression and that hugging, and it actually helps reduce that low back pain. Not only that, if you're having some of that pubic symphysis pain, it gives that compression to help hold it here as well. And the other great thing that it does is that growing weight of your belly and your abdomen puts a lot of pressure on your pelvic organs. Your bladder and your colon sit right in these muscles. So it lifts a little bit off of your pelvis and almost gives it a rest. It gives it a break. And as a physical therapist, I was on my feet all day long seeing patients. And so having that lift kind of gave me that break that I needed to be able to use the band during my workday. Sometimes people are getting pain with walks. So even if you have a sedentary job where you're sitting on the computer, when you're going to be active, you can put it on to wear it for that. And then I think, Emily, you showed the beautiful pregnancy pillow, which is so cozy and comfy. I feel that a pregnancy pillow is a must. And I can see from the chat that pretty much everyone agrees with me. And this one is particularly nice because I feel like I banished my partner to the guest bedroom because you need a lot of props to help you feel comfortable. So a few things that I'm going to say about maximizing your use of the pregnancy pillow is that, do you notice how in the picture you can see it goes along the back as well? What you can do if you're getting that hip pain, a lot of people have pain in the hip of the side that they're laying on, you can kind of shift yourself a little bit off that hip bone into the support that you have on your back, which is beautiful. And you get the top leg kind of held in a more neutral position. So without that pillow between your knees, the top hip is collapsing in like this, and that can be really uncomfortable. When you bring it up and out, it gives you more space in the pelvis, and so you don't get as tight and cramped as you normally would. I think so many people here, if you could see the chat, are saying, I love this pillow so much, and I loved it too.
I can't wait to see the chat. I also want to call out as a labor and delivery nurse, a tool that we use in your labor is a peanut ball to help keep your pelvis open. And so, even in the final weeks of pregnancy, we encourage patients to sit on a birthing ball to keep the pelvis open. And I love that if you're getting cozy in your bed at night and you're sleeping, yes, this is keeping you comfortable, but it is also encouraging your pelvis to go in this open motion versus inward, which can be very helpful for when your body goes into labor. We're going to come out and answer questions in real time because that's what is our favorite thing about these classes is actually just addressing some of your questions. Before we do that, we have a couple resources now for you and then more at the end, especially giveaways from Mom Cozy, which is the best. But I do just want to call out if you're sitting here in this class and you're starting to feel like you're brewing pregnancy questions, whether it is thinking about feeding, picking a pump, thinking about your birth plan, your postpartum recovery, anything, NAPS does now take insurance. And so a lot of insurances will cover prenatal visits with us through telehealth. So it's a no-brainer. Just scan the QR code. It's a unique link to our company. Just see if you're in network. If you're in network and you're leaving this class or any of the other classes in this series with random questions about your pregnancy, preparing for labor and delivery and postpartum, if you're covered, we can just set up a free like a free class or a free call together. So just want to make sure everybody has that. And then we wanted to give everyone a gift from NAPS for being here today. Our most popular prenatal class is infant and child CPR with first aid, and we offer this monthly at NAPS, sometimes more. It's usually $125. We'd love to gift it to all of you today for being here for just $25. And so I will put the link in the chat. You can find the class on our website as well. When you check out, if you use the code MomCozyCPR, it will make the class $25 for you. So with that, we would love to answer as many questions as possible. I am going to open up the Q&A and throw some questions out there in the world. I'm going to anticipate they're mostly for you, Dr. Alex, and if they're for me, I'll answer those as well. Let's see here.
I can start with one, Em. Do you
Okay,
mind?
you go. There's so
Okay.
many. Yeah, go
I
ahead.
know.
Go ahead.
So I noticed it was mostly in the chat actually about using kinesio tape or using belly tape, and that we certainly could mention on the tools, but I obviously felt that the two tools that we had listed are my faves. But I think if you don't have sensitive skin and your skin can tolerate it, kinesio tape is a great idea. I use kinesio tape on a lot of my patients, and I saw that question kind of come up a few times. So that's great to just mention that belly tape can be super helpful and provide support as well. And you can use it with the Mom Cozy Band, which is what I did.
I'm going to grab this one because it feels OB related. And the question is it okay to take Unisom as a sleep aid every night? So let's just talk a little bit about Unisom, also another drug out there called Diclegis. It's pretty rare for us to have medications in pregnancy that we comfortably say, yes, that's safe. Often when you're pregnant and you ask your provider or anyone about things that you can do or take during pregnancy, the answer is usually, no, we can't do that or it's not safe. And often it just ties back to the fact that we literally just don't have research on it. When it comes to Unisom, which is also a drug or ingredient used in Diclegis, that is actually a medication that has been studied and it's labeled as a category A medication. So a lot of providers, especially if you're tuning in here in the United States, use these in early pregnancy to treat hyperemesis or nausea and or sleep. And when you look at Diclegis is a form of Unisom and also B6. So B6 is a vitamin that you can get over the counter. So sometimes they're put in combination. So if you are having trouble sleeping or you're having trouble with nausea, those could be good options for you. And that would be a great question for your provider. What are the options for me in terms of what you can take?
Field 1M if you want.
Yeah, and I also see hemorrhoids. So field what you saw, but maybe you could come back to hemorrhoids too. Like what are they and how common are they? That would be great.
Yeah. Okay, cool. Yes. This was an easy, quick one, was how many sets and reps for the exercises. And I think it's very person dependent. The other question was, can you overdo it? Absolutely, you can overdo it. And each of you know your own body best. In physical therapy, we usually do 1 to 2 sets of 10 reps. As you could see when I was demonstrating, I just did 4 or 5 just so you could see what the motion should look like, but you can do a few more than that when you're doing it at home, and really just do it to your breath. So don't hold your breath while you're doing the exercises. Certainly think about getting those nice long breaths into your back as you're doing it. You want me to dive into the hemorrhoids?
We have to do the hemorrhoids. There's a few in there. Like what are they? And
okay, so hemorrhoids are those kind of pesky little balls that you get around your anus. They can be externally or internally found. And sometimes they itch, sometimes they hurt, and sometimes they bleed. Quickly to differentiate between a fissure and a hemorrhoid. Fissures, it feels like almost like cut glass when you're having a bowel movement. It's a tear or a cut inside the anus, and those bleed quite a bit as well. Hemorrhoids are more so these balls of basically a prolapsed blood vessel. And so when you're straining or pushing too hard from constipation, and just from that extra weight during pregnancy, these little kind of swollen vessels can come in this area. And they're really common, but they're hard to talk about and they're difficult to deal with. So some of my favorite techniques are to use one of your perineum ice packs and just tuck it between the cheeks to ice it so that it reduces the swelling. Sitz baths are a huge one. So just putting a couple inches of water in the tub, or you can actually buy a sitz bath that sits in your toilet. Using Preparation H and other ointments like that. We use Anything But at our clinic that sort of help to shrink it. And then also getting your colon moving the stool through you at the right interval. So drinking enough water, doing some exercise to help the stool move through you, getting enough fiber in your diet, adding fiber too quickly can increase gas and discomfort. So just kind of incrementally increasing it if you haven't been taking in a lot of fiber. And then certainly pushing properly. So that's where the pelvic floor comes in. And I won't spend too much time here, but you want to expand, open, and relax the anus when you're having a bowel movement. The push should come from up above in your abdomen. And oftentimes people will say, like, pretend like you're blowing bubbles when you're pushing for a bowel movement, or you can make a shh sound or a sound to help generate pressure. I think about it like a French press, if anyone's ever used that for coffee, where you're pushing down towards the open exit. So hopefully that answers the hemorrhoids.
Every time I teach with you, I learn a new little way to describe something, and the French press one is new. That's a new one for me.
Hey, ladies, we have a lot of questions around like vitamins and like what's safe to take. What's your take on that generally, Emily and Alex? I'm seeing D3 is being thrown in there. Magnesium, diphenhydramine for nasal congestion. Like, what is that? What does that look like?
Yeah, I feel like I sort of started to elaborate, like give you a little bit on that. It is very common that when you go to your provider and ask for what is best or what is safe in pregnancy, that the answer is nothing. There was a doctor that I used to work with here in Boston, and she literally would say to people, nothing. And I used to wonder, wow, that felt very abrupt. But when I talked to her, she's like, we truly the answer is we don't study these things in pregnancy, right? So what we do is we use things that based on what we know about them, we can assume that they're likely okay. So when it comes to vitamins, really truly, you should take, if you can, if you're not too sick, a daily prenatal vitamin. Folic acid has really great research behind it, especially in the earlier stages of pregnancy. If you're taking a prenatal vitamin, and by the way, we have a little video on this inside of Nurture, they're all good. Every prenatal vitamin is claiming to be the best, but you're looking for like your standard key ingredients that they're all going to have. Most providers will feel that that is acceptable, that that's all you really need, especially if you're eating and staying hydrated and doing your regular, like a somewhat regular diet. But even still, like my patients who are very sick and not eating a regular diet, we're still not often giving them much in addition. You may be offered iron at some point in your pregnancy. A lot of women's iron stores start to deplete in the pregnancy, and we want to make sure you have good reserve for delivery. And outside of that, all of your other extra vitamins and supplements are not well supported anywhere. And I'm not saying no, you can't take them. You just have to think about it's like anything in parenting. We're looking at risk benefit, right? And so, like, what is the potential benefit? What could be that potential risk? And those are the questions that you want to ask your provider. So, okay, we don't have research on this, but what do we know about magnesium or fish oil? Like, what do we have? What do we know? Is there a risk? And you're just kind of weighing those things to see what you feel comfortable with. But again, and then once the baby's here, it feels like everything that you were told that you couldn't do or take, it all changes again, which is obviously really great. I'm having you think about the fact that we just don't always know. And the placenta and what travels to the baby, the oxygen and the nutrients and the waste that goes back out, we want to be mindful of what you're consuming, obviously, when we don't know, if that makes sense. Is that helpful?
That was extremely helpful. Thank
Okay.
you so much. I know we get a little bit granular sometimes of our particular situation,
I
but
know. And I
it's
don't want to be like give you a blanket answer that isn't helpful either. I
yeah.
do want to encourage all of you to be talking to your providers about this stuff. And if you're told no, or you're given an answer that isn't elaborate or meaningful, then just say, what are the options? What's the
Yep.
risk? What's the benefit? Is there research on this? Or if it
Exactly.
just always been done that way, right?
Yeah, that's wonderful. Well, we are going to move on, but please, everybody, tell us how we did today. We have a 5-minute survey. Snap a picture of this QR code. The reason we're able to deliver this wonderful evidence-based education for free to you is because of you taking this survey. So it really does matter. Please, please, please take this survey with us today. And again, you will receive an email on Monday with the recording as well as the survey link, but don't leave. We have one more fun thing for you today. We have the giveaway, the Maternova Mom Cozy Belly Band that our wonderful presenters talked about and love that they use. I'm going to put the link to the belly band here so you can read all about it. And guess what? If you don't win today, you can just get it anyway with that discount code WebinarQ1. All right, so how it's going to work? We are going to give away 5 belly bands. And I know this is highly controversial, but I am not biased at all. I just go to the attendees, I scroll, and I let my cursor stop. And whoever gets it, gets it. So if you win, if I call out your name, you have to put in the chat here. And don't start putting here now. I know all you wonderful ladies are going to say here, but don't do it. Only if your name is called. And then you will email me at mcp@momcozy.com. And then please add your first, last name, address, and phone number to the email. All right. So here we go. Our first belly band is going to stop. Michelle Blackwell. Michelle, are you with us? Please type here in the chat. Michelle Blackwell.
I'm looking.
We're waiting. We're waiting. Okay. Emily, keep looking out for Michelle. I'm gonna
come out so I can see everyone if that's see the chat
yeah,
better.
that's
Okay,
perfect.
great.
Michelle Blackwell. All right, the next person is
I don't think so. I think you're gonna go on to the next one.
yes. Crystal Fincham. Crystal Fincham, spelled Fincham. Crystal, she's here. All right, send us an email, Crystal, at mcp@momcozy.com. All right. The third winner is going down to the list. Yasmin Gobrial. Yasmin. Ghobrial. Yasmin, are you with us today? She's
Yep.
here. All right. Lucky number 4, stopping. We have Tracy Perez. Tracy Perez, are you with us today? Tracy. And Michelle Blackwell, we're still looking out for you. Must be present to win.
I don't think Michelle is showing up, so you might be picking another person here.
Okay. All right. Well, we have Tracy Perez as well. We're looking for you. All right, and stop it. Oh, Michelle Blackwell is here. She just sent us.
There you
go. All right. The next person is Christina Leslie. Christina Leslie, are you with us? And we are still waiting for Tracy. She's here. Did Tracy Perez check in, Emily? I don't think we got Tracy.
I don't see Tracy yet. I'm scanning through. It's moving quickly.
Okay.
See Tracy, if you're there, just tell us one more time.
If you're not with us, we're gonna give it away in 5, 4, 3, 2. Okay, I'm gonna give it away to somebody else right now. Here we go. The last winner, closing my eyes and stopping, is Taylor House. Taylor House, are you with us today? House as in House. My house is messy. I need to get a cleaner in here as soon as I possibly can. All right. Well, I have those names. Congratulations, Taylor. Next week, and we'll keep an eye out for you in the chat. Next week, we are going to have Emily present on safe sleep and sound nights. So if sleep is important to you, I highly recommend that you attend next week's presentation. And please bring a friend next time.
Yeah. Just so you know, you'll be receiving an email from NAPS on Monday, which includes
Monday.
the recording to this class, information on how to sign up for the next free class in the series, information for Dr. Alex here, as well as the CPR code that we provided. If you need anything, or if you're feeling lost, or you just need help, please email me back at that email. But thank you all for being here today. Thank you, Dr. Alex. You're always incredible every time I work with you. And thanks to Mom Cozy for hosting these. It's really wonderful that you do this. So thank you.
Thank you, everybody, and we'll see you next week. Take
Bye,
care.
everyone.
Bye.